We're going to talk about the 2021 grant program that we have. Teresa Fields, prior to me, was doing this grant program, and she has since retired and moved to Florida, and I'm so jealous. But I'm happy that I can help you with this. So we'll get started, and we hopefully, if you've done this before with us, you won't see there's a lot of changes, but we have made a few. And if you're new to joining the grant program with us or considering applying for the grant, we are super happy that you're considering that, and hopefully you'll see what an easy process this is. Just a reminder, Debbie said this before, a couple others had joined us. If you did not receive the handouts this morning in an email because you registered ahead of time, they are on the side in the tab under handouts. So it has the PowerPoint for today that you can download. It's got an example of the grant application. So I just filled in whimsically to show you what it would look like if you filled it in. And then it's got the app itself, so you can download that and apply yourself. It's got part one and part two, and we'll talk about the different parts. All right, so let's get started. This is our mission to be a remarkable partner for whatever risk lies ahead. And we'll talk about why this is important in a minute. And our vision at Inspirian is inspiring new ideas and actions to effectively be able to manage our partners' risks. These are our core values. I won't read off all those to you, but I think you'll find that, hopefully, you'll find that we do live our core values, and it's all a part of this grant program as well. So the purpose of this is in alignment with those mission, vision, and values that I just shared with you to continue to offer our grant program for our members in order to be a truly remarkable partner with you, where we can work together with your unique ideas and things that you come up with and actions to effectively manage your risk there at your own facility. The program objective is to encourage and support our members' efforts in developing innovative, safety sensitive projects while mitigating the costs of developing, participating in, or enhancing a risk reduction strategy program and process. And y'all, the things that you can come up with for this grant are really limitless. I'm going to share with you some examples, but I mean, it's really up to your imagination of what's going on in your specific facility. Our goal here for the grant program is to provide a tangible incentive to decrease the number and severity of workers' compensation claims while improving employee and hopefully patient safety at the same time. Furthering that positive impact, the ideas that are generated by the grants that you submit may be shared with other fund members. So hopefully you won't only help your own facility with this grant project, you might in turn help millions of others or hundreds of thousands of others, because hopefully it's something that can be adapted to utilize in each other member's facilities as well. So just an overview, we're going to award up to $50,000 in grant money. That's a total of 5 grants if we have that many apply. And that's up to $10,000 each for a facility. So you can ask for as little as $900 if that's what you need for your grant program and process at this time, or you can ask for up to $10,000. And you can also match some of those funds. So let's say, for instance, what you need to implement costs $25,000 and we're only offering up to $10,000. Your facility could match with that $15,000 of in-kind funds. That way you could make it to the point that you need. Facilities can only submit one application per year, and the facility must include a budget for the proposed project. We have to see what you're going to be able to do with the money that we want to award you. And an initial implementation report is going to be due about 3 months after the project start date. And I'll share all those dates with you as we go through this. So progress reports also have to be submitted, and the outcome has to be measured at a 6-month and 1-year time frame from implementation. HWCF loss control members will assist you any way that we can in that reporting process if you need to. All you have to do is pick up the phone, give us a call, shoot us an email, and we'll walk you through that process. It's not a big deal. It's not all that formal either. 50% of the grant funds will be paid on March 21st 25th, 2021. That's the day we're going to announce our winners. And then the remaining 50% of the grant funds will be paid following the review of February 1st, 2022 progress report. So no later than February 14th, Valentine's Day, is when you'll get your second payment if you are indeed a winner for one of these grants. So think about that. If you're applying for these grants, we're paying 50% up front at the beginning whenever you win, and then we'll pay the other 50% up in February. You need to refer to your handout or grant package for additional information, and we'll go through that as well. You must be a member of the Healthcare Workers Compensation Fund to apply and be eligible to win this award. Applications have to be received no later than close of business on April 30th, 2021. Since we're starting a little late this year, we've extended that turnaround time period for you. So you have a little bit of extra time to figure out what you'd like to apply for the grant, finish that application process, and get it into us. But our grant process this year, we're trying to streamline that and do it online. So hopefully you'll be able to fill out your grant instead of handwritten. You'll be able to fill it out electronically and then turn it back around to us. Projects must be adaptable for use for other fund members, and the applicants must be willing to share your project information with others so that it could potentially, like I said, help thousands of others, not just your facility. A detailed budget again must be included. We have to know what's being done with the money that we provide you, and a project coordinator must be identified, whoever that may be. And that's just going to be who's responsible, who I need to stay in contact with to get your reports in and things like that. Applicants must be agree to submit periodic progress reports, and those dates are listed there: November 1st of this year, and then February 1st and August 2nd of next year. So some more criteria: your application must include a letter of support from your CEO or your administrator and from a senior leadership if they're a collaborating partner in this. So for instance, if you're applying for a grant to, let's say, make an improvement in a very specific department, then we would like to have just a short, y'all, it's nothing, like I said, very formal, just a short paragraph letter of support from that department leader to say, hey, I'm supporting them applying for this grant for the changes in my own department. The project must be specific risk reduction initiative related to employee or workplace safety, and your desired outcomes must be identifiable and measurable to an extent. These are some exclusions. There's very few, as you can see, to our grant process. The funds can't be used to hire new employees, make new employee positions, or bring on additional staff. And the funds also cannot be used for previous things that you've put into place that you'd like reimbursement for. We would like for it to be something that you've either got currently going on or that you want to implement here shortly, so that we can help you with those things. The grant process itself, you need to be sure that you complete all the forms that's necessary in the application package. And again, like I said, we tried to streamline this and make it easier so you could do it electronically this year. What I would encourage you to do is be sure that you keep your answers fairly short. Any additional information you want to add, just freeform type out on a blank page and attach it. And on that application, put C attachment, because otherwise there's a limited amount of space on those forms, and the more you type, the smaller the print gets. And I did that in my sample or my example for you to show you that you just don't want to overtype too much. Keep it short and sweet on that form, and then free type whatever you'd like to and attach it. Pay special attention to the requirements and the criteria used to score the application. So you'll see that there's two parts to the application. And if you've ever applied in the past, you had to participate in both parts. This year, we made it, I think, a little simpler. Everything that you need to fill out is in part one. So whatever is in part one, you need to take care of to submit back to me. But part two, we want you to have access to, because that is how you're going to be scored. And we want you to know how you're going to be scored up front so that you can better prepare your application and what you're sending us. So there's the potential that you could receive the highest possible score. And then, of course, you would be more eligible for the grant winnings. Scoring is done by independent reviewers that have similar programs. So nobody within our organization is going to be doing any scoring. And we sanitize those grants. It's one of the reasons we made it electronic. It'll make it a lot easier for us. We sanitize those grants so there's no identifying information whenever we send those off to be scored. We actually send those to people in other states that have programs very similar to ours. They're very familiar with grant scoring and they're used to doing it. And they've actually done it for us for several years now. So we don't want them to know who's who whenever they're doing that scoring. All right, and to be eligible for considerations, applicants must submit all requested materials, including your detailed budget proposal. Monitor the process to ensure all application requirements are completed appropriately and submitted no later than April 30th, 2021 of this year. The winners will be announced at a live event on May 25th, 2021. This is a little different than how we've done it in the past. Most of the times we've gotten together as a group and we've announced the winners at a big formal meeting at our office. But because of COVID and everything that's going on this year, we're going to try something a little different. There'll be more details coming out as this goes on, but just envision something of a live event on our website where the people at our office are in party mode, ready to hear who the winners are, and we're going to have some of our staff members go to the facility of the winners, ask them to please come outside around one of your signage areas so that everybody can see who it is. We'll live stream it with our cell phones, and we're going to announce the winners there and present you with your first check. Organizations receiving grant funds will agree to the condition of participation to sign an agreement with us to meet the stated goals within the budget outlined in the proposal. You'll also implement activity and program plan as outlined in the proposal and complete progress reports and measurement outcomes as requested. Like I said, it's just 3 times that you have to report back to us, and that's through August of 2022. So we're not going to be constantly down your throat about this stuff. We want you to work on it, get it implemented, and just give us some snapshots of things as they're progressing. And then again, remember, we want you to share your information and your projects, your measurement outcomes with our other fund members, and we'll help you do that. So just a quick example, and this is the example we've used in the past, of how you might come about with what you want to do with your grant. So let's say you're reviewing your OSHA logs and you realize the majority of your recordable events over the last year have been muscle strains. And after further investigation, you find out that most of those muscle restraints were a result of patients being transferred. You calculate your current rate of muscle strain injuries by dividing the number of muscle strains by the total number of injuries entered into your log. So if you had 9 muscle strains out of 20 injuries, then that rate would be 45%. But y'all, you do not have to give us specific percentages. In some of these grants that have been awarded in the past, people just simply gave us numbers. And it doesn't have to be a specific time period. It could be based on injuries over the last 5 years. It could be based on injuries over the last few months. That's totally up to you. That time period is not relevant to us, except for, you wouldn't want to go back 20 years and not have anything most recently. And like I said, you don't have to give us percentages. You could say there's been 10 staff injuries in the last 2 years involving this, let's say muscle strains. And you could say we had a loss of 45 days of work, a loss of 200 days of restricted work, and it totaled $115,000 in workers' compensation fund monies that were paid out, either for the injuries themselves or the lost time. Something that simple. In this example, let's say that you get with your risk manager and your employee health nurse and to talk about this grant, and you determine that you need new equipment there at your facility to handle patient transfers more safely. You also want to do a train the trainer program whenever you get this new equipment. That way, from this point forward, you have somebody in the facility that can train new staff, your current staff first, and then new staff as they come on, so that this is an ongoing project for you to help prevent these injuries from this point forward. Additionally, let's say that you talk to your loss control consultant with Inspirion and schedule mandatory back safety and proper lifting classes for all your current employees. And then you want to schedule that maybe twice a year from this point forward so that you catch new employees as they come in. You set a reasonable, attainable goal of 25% reduction in your muscle strain injuries related to patient transfers during your first year of implementation. And that's important for you to think about is what you want your goal to be. Naturally, you'd love it to be 100%, right, on everything, but that may not necessarily be an achievable goal for everybody. So be sure that you try to be realistic when setting that goal. You modify your policies and procedures to include training for all new hires and participate in patient transfers and an annual refresher course for all other employees. You receive your new equipment, you put your training into motion, and you continue to track your muscle strain injuries and measure your progress quantitatively throughout this time period. You submit your implementation report to HWCF after your 3-month period and a progress report at 6 months and 1 year. You evaluate your progress toward your stated goals. Remember, that was 25% in this example. And you continue to evaluate the effectiveness of your intervention. Then all you got to do is come up with another great idea for next year. Apply for the grant again. There's not a limit set to how many times you can apply annually for this. We have had several members that have won multiple awards through this. So we encourage you, even if you don't win this year, apply again next year. You can do it for the same thing or you can change things up. But feel free to get back with me following this grant process, and I will give you feedback on how you scored out and things you might do to improve it in the future. I'm happy to help you that way. So, just want to show a few examples of winners in the past to give you some thought processes and ideas and show you that really this is all over the place. We had a registration department safety and security update that won one of our awards in the previous years. So they identified that they had, let's say, 10 employees that had been injured due to the design and the safety and the security in that department. They submitted their grant and stated that they had two lost time events out of that, and they had a total of 45,000 and some odd dollars that were paid. And that was over a 5-year time span that they had those 10 injuries per se. So what they did was they basically redesigned so that ergonomically their staff could work safer in that department. And they sent us pictures initially whenever they applied so that we could see what the problems were. And then after they won, they sent us pictures while they did their redesign so we could see the updates. And I encourage you to do that as well. You know, a picture is worth 1,000 words, and we love to share that. Emergency communication method is another one of the examples that we like to share. So this was actually not even based on real injuries. This is where you've got to think outside the box. This is where a facility did an active shooter drill. They involved their local police department, their current staff members, and their current patients were involved as well. They were all notified. They did this drill, and whenever they did it, they determined that approximately 30 people would have died had that been a true active shooter event because the lack of emergency communication that they had between everyone. So based on that, they submitted those numbers to us and they applied for the grant for an emergency communication method and they won. And they utilized it to purchase panic buttons and hard drive equipment as well as software equipment so that they could better alert people during emergency settings. And they used it for more than just active shooter. They used it for weather awareness and any other type of emergency procedure. Colored Alert Wax was one of our winners as well. And this facility came up with this and asked that, you know, they had some slips and trips and falls in their facility, and some of them were related to spills that were not noticed by staff members. So they found this red wax. It goes on clear, and a lot of times what they found were the spills were also clear. It was frequently water or something of that nature, so it was difficult to see it. With this system, whenever there's a spill anywhere on their waxed floors, it shows red. The fluid turns like a red color so that you know that there's been a spill. And so we were able to help them implement that. Mobile patient lift system is another one that I love to share because this has actually been through several winners. Multiple different people have applied for either lifting or patient transfer devices to assist them. So this is one example. A facility reported to us that they had, let's say, 15 work-related injuries as a result of trying to lift patients ineffectively. They had about 250 lost days of work because of those injuries, and they had over 500 days of restricted work activities where those people were limited in what they could do. And that totaled approximately $130,000 lost for them. So they applied for the grant and they put down that they were hoping their reduction would be 25%, and they won that grant. And they were able to install that lift equipment. Next on our list, we have replacement of meal delivery carts. We had a facility who reported that they had meal carts that were being pushed manually to deliver patient meals. It was 120 patients. They delivered the meals 3 times a day. The weight of those carts were 365 pounds. So you can imagine they did have some injuries for staff in pushing those carts that many times every day, 7 days a week. So they applied for the grant in order for them to be able to purchase lighter, safer carts. They won the grant and they were able to purchase 10 new carts that weighed 175 pounds versus 365 pounds, which has significantly reduced the injuries directly related to pushing and pulling those carts throughout their facility. Lastly, we have a security system for building entry. This is another one of those think outside of the box. This was not related to any direct injury at the moment that had occurred. This was a facility who was opening a new place in a new area, and they did some research in advance and they found that it was a high crime area. So they released to us in their grant application how many assaults had occurred in that area, how many shootings, how many robberies, those type things, so that we could see the danger in that area. And they applied for the security system so that there was no entry to the facility once they got it completed, except for through name badge swipes or a punch entry code. And so they applied for that and they won the grant and they were able to implement all that. And that in turn prevented future potential staff injuries related to the crime in the area. So, like I said, this stuff is really all about what you think through. It's not limited to just one or two specific things. We want you and we encourage you to think outside the box, but think about things that are true, real, and could be measurable to you. Excuse me. So here is a slide on our critical dates, just putting them all in one place for you so it's easy to find. April 30th is the submission deadline for the application from you. May 25th is going to be when the winners are announced live, and that's when you'll receive your first check if you are a winner. August 2nd is when you must begin your projects by. So that's giving you some time between when you know you're a winner before you have to get everything purchased, installed. You need to be on your way with that stuff. Because November 1st would be when you report initially to us that you have begun the project and here's where we're at this time. And it's not that you have to measure anything at that point. We just want to know how the implementation phases are going. Your first real progress report's due on February 1st, 2022. That's whenever we want to know how things are going. February 14th then would be the last date for your next or your final payment in the grant monies. And then August 2nd would be the final report that you would give us. And that's basically the completion, the 1 year point from implementation of your grant project. So there's some information listed here that you can go to. I just want to briefly let you know about the www.hwcf.net. If you go to that website, then you are going to there's going to be a banner page that you can click on that links you to all this information, or you can go to the resources at the top, click it, and then it has a specific category for grant information. And then once you go to that, it's going to just give you a little information about our grants. Like I said, it's our 4th year. We've given over $121,000 in grant money away during those 4 years. So we're very proud of that. But it will also have all the links for you. It's going to have your application part 1 and part 2, Remember, part one is everything you're going to fill out. Part two is just how we score it. It's going to have your sample or your example that's listed in there today, as well as your handout. And then it's also going to have this PowerPoint and recording. So if anyone missed it today and is not going to be able to do it Friday, and you want someone else to hear this information, there'll be a link on our website for that so they can hear it as well. The Inspirion website that you see listed here, if you go on that site to try to link to this, you go on and then you go to resources and it's going to say blog. And if you hit that blog, it'll take you to several of our blogs, and one of them is specific to the grant. You go there, and that's going to connect you to everything like I just mentioned on the HWCF site. You can contact me directly. My information is listed on the slide. That's my cell phone number and my work number, and then my email address. I will encourage you, please, to try my email first because it's the most likely way to get me to respond back to you. But you're welcome to try those numbers as well. And I'll get back to you one way or the other. And like I said, I'll help you with your thought process through this. I'll help you if you get stuck on the application of what to put where. Be sure that you include all your attachments that you want to include. Remember the letter from your CEO, and then the letter from any other department leader, and any specific additional information you'd like us to share during the scoring process of this. I do want to take just a moment to thank our HWCF Board of Directors. Without them, we wouldn't be able to have this project. They are gracious enough to continue to support it because they do value the worth in it. They know that it is helping prevent employee injuries and, in some cases, patient injuries as well. So they are 100% on board with this, and we want to thank them. Also, a special thanks to the Mississippi Hospital Association and the Louisiana Hospital Association Trust Fund for graciously sharing their resources for us to get this up and running as of 4 years ago. And then also with their continued support because they are who help us score grants through this process. And lastly, I just want to make sure whether or not you have any questions today, right now, that you'd like to ask. There's a chat box. You can submit your question in through there, and Debbie is monitoring that for me, and I'll be happy to address them in just a moment. Or if it's something you want to talk to me personally about on the side or at a different time, or you just want to think about it for a minute, then feel free. You have all the resources to connect with me. Feel free to just connect with me later if you'd like. I don't think I've missed anything. Debbie, I'll ask you to join and see if there was any questions and let me know if I did miss something.
I don't think so. I thought it was great information. I'm always excited to see what's on everybody's agenda, what's on everybody's strategy, and then how it can improve employee safety. I know you said this, but I know we had at least one person that had trouble getting on. I was helping them get on a few minutes late. So we're going to put a recording of this webinar on the HWCF website. So if you need to listen to part of it again or go back and ask questions like Lisa said, you're welcome to contact her or any of us, or we'll put that recording on there so it's easy for you to rewatch this in case you were a little bit overwhelmed if you haven't done this before. But I will tell you, from participating in grants when I was on the hospital side, this is a very easy application. It's a great opportunity, but it's easy reporting. It's not so cumbersome
Right.
that you feel like you've got to have a extra person to keep up with the data. So we've tried to make it that way because we want you to spend your time being able to implement it and make the improvements, not doing all the reporting for it. So we look forward to hearing what you got to say.
Thank you, Debbie. That's a very good point. And I'm sorry that someone had trouble getting on. And we are sharing this again on Friday. So Friday at 9 and 1, if you'd like anybody else to join live, they are welcome to join then as well. All
And that
right.
registration link is on the website, or it's on the
Yes.
original email that you received from us. So I don't see any questions, Lisa. So we'll say thank you, and I'm gonna close this out. And hope you guys have a great afternoon. Y'all stay safe.
Perfect. Bye bye, everybody.